The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we are getting healthy once again. We've got MyCare Express Care on the show, and Dr. Jabran Nasir is here again. Well, thank you so much for being here.
Appreciate you having me.
Yes, we're glad to have you. Now, you know, we've talked a little bit about medicine, modern medicine practice. It's changed a lot over the years,
Right.
and today we're talking a little bit more about modern medicine. What do you consider that? Like, what is personalized medicine, I guess? Let's get into that a little more.
So Gretchen, over the years, you know, when I was in med school, we were getting trained. Generally, the concept is that everybody gets the same treatment, whether your genetics, your demographics, where you're from, how you respond to medicine, metabolism, all those things are different for everybody. So we are trained and we are practicing for the most part in the same manner, whether a person is from one part of the world versus the other, which is not considered the best
Not
approach.
always worked, yeah.
So the same cholesterol medicine might not work for everybody, and that's why your doctor keeps telling you, well, you need to do this and this. So lifestyle is very important, but your genetics and your personalized care is extremely important. So that's why your levels of hormones, your chemical imbalance is going to dictate a lot of those medicines.
So you need a little bit more background too on people, a little bit more history and maybe
absolutely.
Yeah.
So a generic kind of a treatment for everybody is not going to work in this day and age, because now we're finding more and more why some people respond better to certain medications, certain treatments, certain lifestyle, and why certain diets are better for. So you and I might be very different in our genetic makeup, in our metabolism, and what medicines and what treatments will work for us individually.
What is direct care?
So that's one of the things that I have started recently in our clinic at MyCare. This is a membership where I know that most people, the biggest struggle they go through these days is access.
Okay.
You need to see a doctor, you need something addressed, you need your physical, your workup, your treatment, and you have a wait time of 3 months. And that's the biggest hurdle. If I contact my doctor's office and I can't get in for months, well, that kind of defeats the purpose of me getting in. So direct care is a membership where you have a monthly payment, but you have access to your doctor within 48 hours.
Okay.
You have access to all blood work, any tests that we do in the office, like strep and flu testing. You have X-ray, you have EKG, and you have some medications that we carry on hand that saves you another extra trip to pharmacy and other wait times. So I think access is the biggest factor that the modern day medicine is struggling with, because there's just not enough providers to accommodate all the needs. And that's why an urgent care and primary care is the perfect balance for direct care.
All right, we've just got a little bit of time left. Should we use over-the-counter supplements?
It's a tricky question, yes and no. You should know what's in it.
Okay.
So a lot of times what the label tells you, it might not be enough. If the amount, for example, if you're taking a vitamin supplement and you don't know how much vitamin you should be taking, you might be taking a baby dose, which is defeating the purpose, and you're taking a lot of preservatives, a lot of dyes along with it.
Okay. If you would like more information, go to mycareexpresscare.com. Give them a call at 309-319-2393. Dr. Nasir, thank you so much for joining us. I look forward to having you back soon.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.